Hello there. My name is Michelle Snyder, and I'm a senior in the University of Baltimore's undergraduate psychology program. This semester, I executed an experiment regarding impression formations and mask-wearing habits. During this COVID-19 pandemic, I thought it was important to truly understand how one person forms impressions of another regarding precautionary measures, specifically mask-wearing habits. I hope this survey is both eye-opening and entertaining for you, as there are some interesting findings from it. Several studies have shown how proper mask-wearing habits will slow the spread of the COVID-19 virus. A proper mask would consist of a two-ply, 100% cotton fabric tightly fit over the nose and mouth of a person and secured behind the head or ears. Proper mask-wearing habits would be when a person wears that same mask outside of their home in an indoor or outdoor setting around other people without social distancing. Research shows that positive mask-wearing behaviors and attitudes have been positively correlated with the Big Five personality traits, specifically with extroversion and openness. Conscientiousness and agreeableness have also been shown to positively correlate with proper mask-wearing habits. Now that proper mask-wearing habits have been mandated by law, they have become a social norm. And we do know that people have a tendency to harshly judge or socially punish those who are breaking identified social norms. Although, after 18 months of COVID seclusion and COVID precautions, there has been identified a fatigue where people are lessening their concern about the virus and the precautions. Through this pandemic, new research has shown that conservative affiliated people are less likely to adopt health precautionary measures, while other studies have looked more specifically at mask wearing habits and seen that political affiliation does have a correlation with prediction of mask wearing behaviors. In the past, research has shown that political affiliation can be determined by power and likability of the other person through snap judgments of a person's face. And all of these snap judgments, positive or negative, happen very quickly and can change as situations are fully understood. In our experiment, we developed a scenario where you are in a grocery store and a person is walking down the same aisle you're in. They are either wearing a mask, not wearing a mask, or improperly wearing their mask. What impressions are you forming about that person as you're walking towards them in that aisle during this pandemic? We have two hypotheses in this experiment. Hypothesis 1, those who follow guidelines and social norms of proper mask wearing habits will be most positively perceived. Hypothesis 2, participants will identify our target model as Democrat when wearing a mask properly and Republican when there is no mask on. We had a high number of participants at 268. However, 55 participants did not fill out their survey correctly and 3 failed the attention check at the end of the survey. The ages of our participants ranged from about 19 to 83 years of age. Our ethnicity was heavily white at 74.3%, and the political affiliation was heavy on the Democratic or Liberal side at 70%. Of the participants used, they were randomly assigned to 62 no mask, 76 mask worn incorrectly, and 72 mask worn correctly. Materials used in this experiment were 3 photos of a model edited to look as though he's walking down the aisle of a grocery store, a survey consisting of 18 personality impression questions, those of which highlighted were used in our positive perception scale, a computer to access the survey, and either access to social media where the survey was sent out or the student access pool at University of Baltimore. The experiment was an independent measures design, meaning it was between groups. Each of the 3 photos was its own condition using the same survey for every condition. The scale was on a bipolar Likert scale ranging from 1 to 7, and at the end of the survey there was an attention check asking what the model's hair color was and mask wearing habit. At the end of the attention check, we asked what the political affiliation was assumed to be for the model. When running the ANOVA on our first hypothesis that those who wear a correct mask will be most positively perceived, we did find significance to allow us to reject the null hypothesis, meaning that each group had a significant difference from each other. Running the post hoc test, we did find that the correctly worn mask was the most positively seen, followed by no mask at all, with the least positively seen being a person who wears it below their nose. Discussing hypothesis 1 further, I've broken down the positive perception scale to see what might be driving it. Our data does not show that one measure is driving this scale. However, there is literature to support the idea that consideration may be driving this scale. Consideration for a social norm or consideration for those around you with a health precaution. However, these specific ideas do need to be researched further to get a better understanding. Looking at hypothesis 2, we ran a chi-square test to find significance there as well, seeing that those who do not wear a mask or wear one below their nose are 62% more likely to be seen as the Republican, while those who wear it correctly are at 59% more likely to be seen as Democrat. Discussing hypothesis 2 further, our data does not reflect an adequate number of self-identifying Republicans, meaning that we do have a sampling error in this experiment. We have a much higher number of Democrats over Republicans, so the data may be skewed more to a Democratic view rather than an overall view of mask-wearing behaviors. While participants did rate those with the mask below the nose as more Republican than with no mask at all, it was not significant enough to report on, so those were pretty much the same. So as other studies, what we've mentioned in this experiment have said, political affiliation does influence one's likelihood to adopt public health procedures and also has an assumed political affiliation when we see someone without their mask on. So what could have been done better in the study? Asking about gender in the general demographics would have given a more detailed understanding of who feels what about this topic. Another thing that we could have done better is using a cloth mask rather than a rigid N95 mask. The N95 mask does look really awkward underneath the nose, and that condition may change using a cloth mask rather than a rigid N95. The last thing that could have been done better is having a more equal response when it comes to self-identifying political affiliation. Had we had more self-identifying Republicans in this study, we would have had a better idea of what political affiliation is assumed on a person according to their mask-wearing habits. In conclusion, now that COVID-19 mask-wearing precautions have become mandated, they have become more of a social norm. Our study has shown support to say that those who follow this norm will be positively seen compared to those who do not by not wearing a mask or wearing one improperly. Our study has shown that the public will assume political affiliation based on mask-wearing behaviors in public during a pandemic. While politics should not influence the public health crisis, there is support to say that this has happened. Going forward, future research may be able to use this experiment to understand what messaging needs to happen for a conservative or Republican audience to be able to adopt proper health care precautions early rather than later. And here are the references I used in my study.